We'll spend the next few minutes talking about the physical installation of the software and the hardware of the Florida Probe system. The Florida Probe system will arrive to you in this black carrying case, and let's review the contents quickly. The first thing you'll see, in addition to the user's manual, is a quick installation and start guide that will be very helpful in what we're going to do here. Within the Florida Probe user's manual will actually be your software CDs. We'll have the USB interface box that integrates to the computer and its corresponding USB cable. The 4-position foot switch with 10 feet of cable. 3 of the autoclavable Florida Probe handpieces, and a vial of spare implant-grade titanium tips. There's also a 10-foot encoder cable. If, for any of you who are familiar with digital X-ray or users of digital X-ray, a good analogy here is to think of this cable as your X-ray sensor. This is where the magic happens. This is where the 15 grams of constant force pressure comes from, and this is where the computer is taking its measurement to 0.2 millimeters accuracy. It's important to protect this cable throughout its life and as you're conducting the exam. And we'll provide you with some simple installation hardware like handpiece holders and some cable management. Now that we've ensured that we have all of the parts, we always install the software before installing any of the hardware. From the back of the user's manual, I take out the installation CD and install it on the individual workstation. The software is multi-user, so we can install it everywhere within your practice. Hygiene, treatment, consult, business office, doctor's private office, an individual's laptop. You would have read and print access from anywhere within the practice on the network. It is only restricted by where hardware is attached. So only where hardware is attached would you actually be able to read, to probe and interface with data. In all the other areas, you'd have read and print access within the Florida Probe. When we install the CD on the individual workstation, it should auto-run. And we'll follow the install shield wizard of Florida Probe by clicking on Next and accepting the terms of the license agreement. And by default, the program is installed in the Program Files folder on your C drive. This is typically where you want it installed. Accept the defaults, and then the Florida Probe will install, and this may take several minutes to accomplish. When the install shield wizard has successfully completed, you need to acknowledge it by clicking on Finish. And give it a moment, because the software will install 2 sets of drivers. Now that it is successfully installed, the Florida Probe software has dropped a Florida Probe shortcut icon to the software, as well as a shortcut directly to the patient education movies directly on the desktop. After we've successfully installed the software, we can install the hardware. Always start with the USB interface box. Install the USB cable to the box and to any available USB port on your computer. Depending on your hardware and operating system, Windows will either find the driver automatically, or we may need to browse for the driver. In this case, it found it automatically. The drivers, should you need to browse to them and locate them, you can find them under Browsing My Computer, on the C drive, Program Files, Florida Probe Corporation folder, the FP32 folder, and the USB interface box driver folder. And your Found New Hardware wizard would then find those drivers. That's the location of them. Another component of the system is the 4-position foot pedal. 2 operating side pedals, the main pedal, and we'll talk about the little very important undo button. There's 10 feet of cable with the foot pedal. This is generally adequate for installation in any operatory. However, this is really just a 4-pin telephone cable and can be coupled and extended all the way around an operatory if you'd want to. And this plugs into the back of the USB interface box as well. And now the encoder cable is a 6-pin connector that only goes into the probe interface one way. And I'm very careful about protecting this cable, and I'll hang it in the handpiece holder. We've now successfully installed on the individual workstation. For a network application, we would want to launch Florida Probe the first time from this workstation by clicking on the icon on the desktop.
Welcome to the Florida Probe.
The first thing I notice is that I heard a welcome message. I always want to hear that welcome. The sound is a very important part of this. Not only does it keep me on track throughout the exam so I don't end up with extra teeth or extra pockets, but remember, the computer is delivering the message to the patient. If I did not hear that welcome, then I want to stop and figure out why. Do I have a sound card and speakers? Are they turned on? Are they muted? Is the volume down? But I need to identify the reason why there's no sound before I move on. So tip of the day, which is very helpful, and it takes me to the patient lookup screen. At this point, I'm going to cancel and actually close the Florida Probe software. This part of the installation simply installed a new database file on the C drive of this computer. I now want to copy it from that location, paste it onto the network, generally in the same data folder that you use for your practice management software, to ensure that it's in your backup routine. Because I will browse from all the individual workstations to that database. So we're all sharing the database from operatory, hygiene, treatment, consult, or business office. The location of the Florida Probe database, again, is under Browsing My Computer, the local C drive, Program Files, Florida Probe Corporation, the FP32 folder, and there is a file named fp32.mdb. I'm going to copy it so that I can paste it in your network location. This time, when I launch Florida Probe,
Welcome to the Florida Probe.
I've heard my welcome and acknowledge it. Cancel out of the patient lookup screen. And I want to define the options or the parameters under which Florida Probe works. In the upper left-hand corner of the Florida Probe software, there's a computer icon with a check mark called Options. And there are several tabs within the options. The first is the general options. And the first one is to define the location of the Florida Probe FP32.mdb database. and I simply browse to the location of where that file was located in your network configuration. So second location for storing the images from any images that you would take within Florida Probe, like the patient ID photo. And again, we would want to browse to that location on your network. There is an application language. Florida Probe, this particular language option is particular to the actual software, so that the icons and the language of the desktop appears in English, Spanish, Portuguese, or German. Should you change that language, you have to close Florida Probe and restart it in order for it to take effect. The second tab is the personal page. This is where I tell the computer where I'm going to capture those patient ID photos, either from a bitmap file on the hard drive or on the network, or from a capture device, such as a webcam, even an intraoral camera or a digital camera. I can set the default examiner so that if an examiner works specifically out of one room, it will pop up as that default examiner each time she launches a new exam. And there are places of storage of referral and examiner names, and should there be change in the staff, I can delete an examiner name if I wanted to do so. The third tab is the periodontal page. This is an important one in that, number one, I set the tooth numbering method from either the American 1 to 32 or the International Quadrant method. I also set my recession warning and danger levels and the depth warning and danger levels. The defaults are very good, but you can change them should you desire. The reference visit default is set to the previous visit. By that I mean for comparative values, the Florida Probe is comparing to either the very first baseline visit or the immediately preceding visit, and you set that within these options. For clinical research, there is a verification pass. It's typically not used in the general practice, but it would force you to reprobe until every single probing was within a definable parameter of variance. The print tab is where we define the printer. The color printer is very important to use for the Florida Probe printouts. We can enter a header to be typed at the top of the printouts. And I can establish the languages for the printouts as well as the education component. The Probe Options tab you won't use very often. The Florida Probe software looks for the attached probe each time it launches. However, if there was a tech support issue, it would be the only time that you would refer to this. Sound Options tab is very important. First of all, we establish what language the computer enunciates in. It speaks in 14 different languages, male or female voice. Even in the US, if we have a Spanish, French, German, Russian, Japanese patient sitting in the chair, we can have the Florida Probe enunciate to the patient in their native language. Under the advanced sound options, we can set some more specific parameters. We can have the computer enunciate to the whole number,
1,
even though the computer is recording to 0.2 millimeters resolution, or we can have it enunciate to the decimal.
0.2,
We can turn bleeding on or off,
bleeding,
and we can have suppuration called suppuration,
suppuration,
pus,
pus,
or exudate.
exudate,
We can enunciate either plaque or calculus.
Plaque. Calculus.
We warn when we cross the midline and change arches to help keep us on track throughout the exam.
Midline. Lower arch.
And the warning and danger levels not only can be turned on or off, but can be enunciated with either the warning
Warning.
or a sound effect. Similarly, the danger
Danger.
or a double siren. I set those parameters, click on OK, and apply those changes. The last tab in the options is the email tab. I tell it whether to include the patient's medical alerts and summary, as well as to include a privacy disclaimer. We can type in the name of the practice or the dentist and tell it whether to include the practice's telephone numbers, email address, or website address. Make sure to click on the OK button to accept all the changes that you've made. These parameters will need to be set identically in all of the individual workstations. Let's take a moment and talk about sterilization of the Florida Probe handpiece. In your user's manual, we've provided a laminated graphic talking about sterilization techniques as well as some graphics of how to change the tips, which we're going to review. This is meant for you to post in your sterilization room as a reference. Sterilization is basically a wipe down with a non-staining, non-caustic solution. Cavicide, alcohol, hydrogen peroxide is fine. It is safe to go into the ultrasonic, though doesn't need it more than once every 30 days. Put it into the protective cover, put it into your sterile pouch, and steam autoclave. Statum is fine. No dry heat, no chemclave. The tip, the implant grade titanium tip, is replaceable but not disposable. The only reason that you would change it is if it were bent and you were not able to straighten it. Just needs to be free floating. If you need to change it, simply pull the tip through, rotate it, and this little tip goes in that slit and the opposing hole. It just needs to be free floating. Melissa, Florida Probe is not a new technology. It was developed in 1986 at the University of Florida to calibrate periodontal research. They recognized that traditional probing is inherently inaccurate among different clinicians probing the same patient. And in fact, the standard deviation among different clinicians can be as much as 2 millimeters, plus or minus. Part of that is simply interpreting the lines on a traditional probe. Whether it's a 3, 6, 9, 12 probe or a UNC 17, we still have some inherent rounding errors. And we're looking in the back of a dark hole in the mouth with blood and plaque, looking in a mirror, standing on our head, I like to say. So rounding errors is part of that. Similarly, the amount of pressure that we use on the bottom of the pocket is a contributing factor. If you use 10 grams of pressure and I use 30 grams of pressure, we're going to be different in our results. The healthier the tissue, the more accurate we can be. We have nice, healthy, tight attachment. If we have periodontally involved pockets, the attachment's weak, epithelial, more spongy, and it adds to the degree of inaccuracy. So first and foremost, Florida Probe was designed to be accurate. And in fact, it has a resolution of 0.2 millimeters. Now, there are some technique things involved with it, visual acuity, angulation, and all those things that we're going to talk about today. But the standard deviation statistically with Florida Probe is about 0.6 millimeters. So it's about 3 times more accurate and consistent and reproducible. Okay, let me have your hand, please. It's 15 grams constant force pressure. So regardless of whether you or I are doing the probing, We're always exerting 15 grams, and that's one calibration technique. Now the analogy is that I insert the tip to the bottom of the pocket, I contact the end of your nail, which is analogous to the free gingival margin, and the computer takes that measurement to a resolution or a precision of 0.2 millimeters. Okay? And that's a very good analogy. Now it's also more comfortable for the patient than traditional probing when done correctly. And we're going to spend some very specific time on the techniques that are relevant to patient comfort. Okay? Very simple things that we can do to make sure that it is, in fact, more comfortable. So we're accurate, consistent, and reproducible, more comfortable for the patient, and designed to be solo operator. So at a certain point in the exam, we're going to be able to do everything with this 4-position foot pedal, maintain asepsis, work solo. We're not going to need to grab someone from the front office or an assistant to help you chart while you probe. And those are really the key benefits why people find Florida Probe. But the real power in the system is that the computer engages the patient during the diagnostic process, so they understand their disease. Periodontal disease is just that, a disease. It's not a toothache. If periodontal disease hurt, we'd treat a lot more of it. So we need to take the time and educate the patient, involve them in the diagnosis so they understand and accept recommended therapy. That's what this is all about. So let's take a look at the software. I've installed it on your computer here, and on the desktop is a Florida Probe icon. Now it will also bridge to all the major practice management softwares. We're going to take a look at it as a standalone. I click on the Florida Probe icon.
Welcome to the Florida Probe.
Now I want to hear that welcome. If I don't hear that welcome, then I want to stop and figure out why. Either my speakers are turned off or unplugged, they're muted, but the sound is a very, very important part to it for 2 reasons. Number 1, it helps keep me on track during the exam so I don't end up with extra pockets or extra teeth. And also, the authoritative computer is delivering the message to the patient. You're not enunciating it, the authoritative computer is. And that's the interesting human dynamic. When the computer delivers it, the patient becomes more engaged. Now I'm going to take a very systematic approach to this, and created this flow chart. I call it Florida Probe Step by Step. That'll guide you through the various steps. And this, it was in your user's manual, is a good reference tool. Okay. So the first thing I need to do is to identify my patient. If I have bridged from my practice management software, it's going to give me this information, last name, first name, and chart number. If I'm do a standalone, the first time I see this patient, I want to do new patient. Click on the new patient icon. Now, all that I need on this page, and I'm just going to use myself as the patient. All that I need is enough to identify the patient. Last name, first name, and a unique identifying number. If in your practice you use a chart number, if you use date of birth, if you use social or some other identifier, that's fine. Just enough to identify this Mrs. Jones as opposed to another Mrs. Jones. Okay? And I will click on gender. Now, I'm going to use my date of birth because it's going to flow through to our periodontal risk assessment. So step 1 is simply to identify the patient. Launch Florida Probe and identify the patient. Step 2, there's a heart icon here. This is our periodontal risk assessment. And this is really a query of inherent risk for the patient. So based upon their systemic health, diabetes, immune suppression, Down syndrome, things like that, their smoking habits, behavioral and temporary, pregnant, orthodontia, bruxism, xerostomia. You can do a quick evaluation of their oral hygiene and any medications that they might be taking, as well as their genetic predisposition for periodontal disease, diabetes. If you're testing for the presence of pathogenic microbes is a big indicator. And it is always a function of age. For example, the average molar tooth length is 15 millimeters. If when we conduct the exam, we have the maximum pocket depth or clinical attachment loss of 7.5 millimeters, that's 50% of the tooth length. 50% of a 50-year-old patient is the median. If that were a 100-year-old patient, he's in great shape. If it's a 25-year-old patient, he's in very bad shape. So the age is a very important factor here. The bottom part of this graph, we've just collected by the query. The top will be filled out by the exam, the actual probing, and we'll come back to this and look what value this has for us. Any questions about the risk assessment?
No.
The real value here is in the query. Yes, you have a lot of this information already recorded in your practice management software, but the value is in having the conversation with the patient. If a patient were to ask you, what does diabetes have to do with my mouth? What a powerful conversation to have. Rather than you saying, you know, there's a relationship between diabetes and your mouth. I know from my family history, they don't want to hear that information. But if I ask about it, I'm prepared and ready to have a better dialogue. So let's recap. Step 1 was to launch Florida Probe and identify the patient. Step 2 is to conduct the periodontal risk assessment. Step 3 is a patient education component. And here on your desktop, there's a movie icon. That's the link to the patient education. There are 5 one-minute movies specific to periodontal disease that reside within Florida Probe. These last 3 I tend to run after the exam. What causes periodontal disease? Talks about deep pockets, you can't clean by yourself, toxins and bone loss. Stages of periodontal disease talks about healthy to severe, exactly where the patient is on that spectrum. And do you have periodontal disease? Draws the systemic link to heart attack, stroke, diabetes, respiratory disease, premature and low birth weight babies, and also reassures the patient. 70% of the public has it at some point of their life. They're not alone, and that there are some good treatment alternatives for them. These I tend to run after the exam. But the first and second visit movies I play to prepare the patient for the experience. This is a different diagnostic experience. It's different visually. They're going to see it on the computer. They're going to get a printout in their lap. It's different audibly. The computer is enunciating to them and they're paying more attention, and it's different tactily. It's more comfortable. So we use these 2 movies to prepare them. If I click on play, I'm going to get all those items that are checked. So certainly if you need 3 or 4 minutes to leave the room, you hit play and those are going to run for you. But if you click on an individual icon, whether it is checked or not, you're just going to get that one movie. So that's all preparation, getting started with the exam. Now we're ready to conduct the periodontal exam.